Hello, doctors. Well, today we want to talk about this acute infections diarrhea in children. As we talked last week, we talked about some of the most common cases of morbidity and mortality in children under 5. Well, today this is one of the other main causes of deaths in children. Okay, as always, you can see the DOI and the of this article in this part if you want to get the full information about this. Okay, and as we said, this acute infection enteritis, or including those gastroenteritis, it's still, as we say, one of the most common causes of death among those children in developed countries. As the same as ARIS, these acute infections, acute diarrheic infections are the most important causes for those children under 5. And still will be the question, why children are still dying and what can be done? What as health care people or students or doctors we can help these children to avoid dying for these causes. As we can also notice, infants and toddlers mean children. Typically will have a couple of events of diarrhea once or twice a year. And as we can see, we are trying to make early diagnose so we can offer them treatment, and then the prognosis will be better for those younger children. And well, to begin with, we must understand what is the meaning for diarrhea. We have to consider two facts. The first fact is when we lost the stool consistency. It means it becomes watery or liquid or pasty. And the second thing we must think about the increased frequency that could be more than 3 stools in 20 hours when compared to a normal amount. Let's take a look of this part. When we talk about a normal amount of stools, it means if will be for each person would be different. Maybe I have stools like once a day, but maybe if my common amount or my normal amount it's twice a day, the thing will be that I have to notice the difference. If it's usually once or twice, the problem will be when this frequency is increased. It means, again, if I go twice a day and tomorrow after I ate something that was not, maybe I have poisoning, food poisoning, well, maybe tomorrow I will be stooling like 3 or 4 times. Okay, so both things can also be important. I can have the loss of the stool consistency and also an increased frequency. Okay, so both of them can be also a part of the diarrhea. And the other fact will be if it is presented with or without fever or vomiting. We also have to notice that when we're talking about children, and mainly those newborns or these babies in the first months of their lives, we must understand that these changes of the stool consistency will be totally different from older children or adults. Okay, so in this situation, It's more significant, the indication of the acute diarrhea illness more than the frequency of stool, because babies eat stool like many times a day. Okay. The thing is, we must be thinking about the consistency of the stool. Well, I have here some examples of how we can understand the stool consistency. Okay, we know we go from the severe constipation and the severe diarrhea. Normal stool will be like these two kinds. We can see like a social shape with cracks in the surface, or it can be totally smooth. Okay, this type 3 and 4 will be the normal consistent of the stool. Now, when we talk about this severe constipation, we know we have these separate hard lumps. If it's just mild, will be like lumpy and such like. And on the other side, if we're lacking fever, we can find the type number 5, which means soft lumps with clear-cut edges, as we can see here, the edges. If we have mild diarrhea, then it will be mushy, consistent with rash edges. Okay, we'll see different. And finally, when we have this severe diarrhea, we can see this liquid consistent with no solid pieces. It's totally watery, only water. Okay, we can also have this classification about talking diarrhea. We think about acute or chronic diarrhea, depend on the time that it is present. If we talk about this acute diarrhea, it means it's a short term, usually lasting several days, but less than 7 days. Okay, so acute diarrhea will be less than 7 days. And on the other hand, if we have longer than 14 days, it means 2 weeks, we might consider this diarrhea as a chronic. It can also be called protracted diarrhea. It's a special illness which is clinically characterized by diarrhea that starts before 3 months of age. It's along with a very severe nutritional aggravation, and we have negative stool culture for any bacteria or parasite. Okay. Okay, and well, talking about diarrhea in children, we must understand that we have like a lot of pathologies or causes that can result in the loss of the consistency and the frequency of stools. Okay, we have like examples from bacterial infection, we have viral infection. We may also have food intolerance or allergies. There will be also the presence of parasites. We can even have a reaction for some drugs. And well, we have also all the other chances as intestinal diseases. We have the example of inflammatory bowel disease. We may be also thinking about a functional bowel disorder, as we can notice in irritable bowel syndrome. And we can also have this diarrhea as a result of a surgery on the stomach or the gallbladder. But one of the facts that we must take an account is that about 40% of this acute diarrheal illness in those children under 5 are caused by rotavirus, and some others, like 30%, are caused by other viruses, those kind of novoviruses and adenoviruses. So mainly, as we can see, these acute infections of diarrhea in children are due to virus. In some other percent of these children, we may have a bacterial pathogen that can be identified in the stool. We have these other examples: Campylobacter, Yersinia, Salmonella, Shigella. We might also have this pathogenic E. coli or even Clostridium difficile. Okay, but let's remember most of them will be viral. Okay, so we as we can see in this picture, we can know about 70% of the acute gastroenteritis in children are due to viruses. We have all these possibilities. We may have also some protozoas like Giardia lamblia and Entamoeba histolytic. And the other percent could be about bacteria, the ones that we talk. We might also talk about those elements. As we can see, parasites are acting for these acute infections of diarrhea in children in fewer than 5%. We have as we know, Giardia lamblia or Entamoeba histolytic. Okay. And well, as we saw, this chronic diarrhea infection can be chronic due to those syndromes such as the irritable bowel or chronic diseases such as the ulcerative colitis, Crohn's disease, or the celiac disease. And just a fact, we must remember that Giardia lamblia may also cause this chronic diarrhea. Okay, and well, let's talk about some of the symptoms or signs that we might find in these acute diarrhea infections. As we can see, we have this nausea and vomiting. Just maybe see the difference. When we talk about nausea, is just the inclination to vomit, like feeling that we are going to throw up, but sometimes it is not really imminent. And now, when we talk about vomiting, it's the ejection or expulsion of gastric contents through the mouth, and most of the time it will need some forceful event. It's reflexive. Okay. When we talk about those children under 5, we know this is the condition. It's involuntary, and it's the result for throwing off the food. We must make the difference between vomiting and spitting. When we know about spitting, we talk about that all those babies just let the food or the milk going out from the mouth, and it could be like when they are breastfeeding, or after we are helping them to burp. We know sometimes this spitting may occur because those infants wants to take the word to eat very fastly. They may get some error when they are breastfeeding, or maybe they drank too much milk. So this spitting may occur with no apparent reason. Now, when we talk, on the contrary, about the vomiting, we know that it's typically caused by a disorder. So we might consider spitting is spontaneous and vomiting will be due to a disorder. Of course, we know that vomiting can cause dehydration because the fluid is lost. We are losing liquid, we are losing water through the vomiting. And also, we might think about that sometimes these children cannot drink enough to make up for lost fluid. I mean, they lost fluid and they don't drink enough water, so they will be having a dehydration situation. And there's also another fact that when these children feel so sick, they don't want to take any water or even breastfeeding, or if they are still vomiting, of course, they will be losing more and more liquid. Also, we must take into account that the younger the child is, the greater the risk that this fluid and electrolyte losses will lead to this dehydration. Okay? We have different kinds of dehydration: isotonic, hypotonic, or hypertonic, and of course, it will be depending of the cause of the etiology of this illness. As we know, these fluid losses that has been resulted from the diarrhea and vomiting can be as high as 3 times the circulating blood volume, which is 8 to 125 or 250 milliliters per kilogram body weight per day. So we must be taking into account these numbers. We can also have the definitions from severe dehydration, some dehydration, and no dehydration. Okay. We know that if we have no trouble about these liquids, we have not enough signs to classify some this dehydration. We just give some liquids or food, give regular food to these children, and if we must warn our mothers if she notice that the baby is still vomiting or still having more frequent stools. Maybe we may follow the baby 5 days if there's no any improvement. When we talk about some dehydration, we must be looking for these following signs. It is restlessness, irritability, sunken eyes, drinks eagerly, it's very thirsty, or the skin is going back slowly when we pinch it. Of course, we're going to give more fluid and still having a follow-up. Of course, we are still warning our mothers if they are finding those warning signs. And finally, when we have this severe dehydration, we have maybe lethargy, unconsciousness, sunken eyes, unable to drink or really drinks poorly, and the skin pinch go back very, very slowly. We must give those fluids for severe dehydration. Mostly, we might have to take care of these children at the hospital with the Plan C. Okay, and just as we saw last week on the acute respiratory infections, we may also find those general danger signs for this sick child, and we might find these signs of real serious illness for those children under 5 years old or under months of age. And as we knew last week, we call them general danger signs of serious disease, or in this situation, we know these danger signs for acute diarrheic infections. And which are these warning signs? Well, we know about abdominal pain, blood in the stool, frequent vomiting, loss of appetite for liquids, high fever. Okay, as we know, we can also talk about if our baby refuses to eat or drink, or if the baby or the children or the child gets worse. Okay. We may also think about these dysentery symptoms, which may be present after 2 or 3 days that we have this infection. We get the signs and symptoms, and as we know, we might find some blood or mucus in the stools. Thinking about the adaptation signs, we must think about the sunken fontanelles in infant, which is in this part. Of course, remember this will be less than 1 year old. We have the sunken eyes, which are like very, very deep. If the baby is crying, there will be no tears. He wants to drink a lot. Okay. Of course, the urine frequency will be less, and we might think about the diapers, thinking about how many times we must change these diapers. And of course, also as the urine has been decreased, also it can change the color. Okay, when we talk about these warning signs, we can also find rapid breathing, increased heart rate. He must be restlessness or irritability. He may also be lethargy or weakness, and poor skin turgor. It means pinching a fall of skin at the abdomen, returning slowly to normal. We may also think about this travelers diarrhea. It's not really very common in children under 5, but we might also get to see the difference. When we talk about this travelers diarrhea, we know it's something caused by a bacterial infection or parasite infection, or even could be a food poisoning. And it is when you visit a new country and then you drink some water or some food that makes you have a diarrhea situation. It is very common for those tourists to come, especially in Mexico or Central America, and it's most of the time, as we know, this unpleasant souvenir caused by these intestinal bacteria, virus, or any other microbes that are present in the water or the food supplies of the country that we visit. So that's why many people who come to Mexico, they rather bring their own water, or they use water in bottles. Just to think about this is, as we said, eating or drinking contaminated food or water, and it's something that it's not really bad, but it's very uncomfortable. Of course, these risks of infections will be depending on the type of exposure, and if we have a higher risk if we eat raw vegetables and fruits and drinking just water. When we make this culprit, the most common bacteria that is found is the Escherichia coli. And so it was just to see the difference between the regular diarrhea for children and this special situation. Okay, so we will be having a meeting at the Zoom, and then I want to talk about those warning signs in the acute diarrheic infection in children under 5 years old. Thank you, and see you later.